All right. Good morning, everybody. Welcome to the EQIP Subgroup meeting. I'm hoping we're not going to have to take the entire time today, but we have a lot of important updates on EQIP, and we're going to jump right into it this morning, and I'm going to turn it right over to Jessica to go ahead and get running. So go ahead, Jessica.
Wow. Okay. Yeah, we're going. We actually do have a relatively light agenda, but wanted to ensure we're sort of moving the conversation along, as well as providing updates for some of the things the team's been doing on the back end the last couple of weeks. So I'll start with kind of reviewing where we are from a PACES and PY4 standpoint, and then hand it over to a colleague of mine to talk about the practice transformation grant and what that may look like for also for PY4. So just as a reminder, this is sort of what we set out as our episode timeline as far as decision making. As you know, last month we formally came and approved moving forward with the PACES group starting in calendar year 2025. Really over the next couple months, and what we've been doing is the additional analysis that has been brought up through some of these specialty meetings or things that we've identified as far as considerations when it comes to eligibility or additional policy decisions. So that's essentially what's been happening, as well as working on some resources for our new participants and current participants for next year, including things like an enrollment transition guide, the playbooks, we've put out some of them via Excel and things like that. So all of that is sort of what's happening now. We'll use the next couple subgroups to update you all, but you may also be pushed out information intermittently because we certainly don't want to wait if there is sort of relevant information. And then all of that is, July is when enrollment opens for the next calendar year. Just as a reminder, we have our learning system website, and there is an additional subpage specifically for PACES, which has some of the background that was shared in prior meetings, recorded specialty meetings for some specific episodes, as well as the Excel downloads of the playbooks. So here's sort of from a decision standpoint, here's where we are standing. Currently, we have approved 2 custom PACES episodes. So what that means is we obviously are going forward with these GI episodes, but the standard PACES had a much longer episode length, and we did get a request and feel like it's completely valid to shorten the episode lengths to mirror that was in Prometheus. So those are for the colonoscopy and upper GI episodes. We have also gotten requests to add 2 net new episodes. These are already vetted PACES episodes, so essentially we can very easily add them. That is the rheumatoid arthritis and rotator cuff. So those will also become available during the enrollment period. And then we've been working for a couple months now with some clinical experts about developing and then finalizing 2 behavioral health episodes that will become available. There's also some additional conversations about future behavioral health episodes, in PY5 and on, but we really wanted to make this a focus for this year. And we're really happy that essentially most of them have been finalized. And we believe in the next round of next monthly release of the PACES methodology, they will be incorporated into them. So that is recurrent depression and chronic anxiety disorder. And a big thank you to Dr. Roca from Hopkins for really helping a lot and collaborating on that with PACES. So next steps, these are additional things that are happening. We mentioned that playbooks are available, so most of them are up on there. There are a couple that we are still working on and don't want to publish, and there's analysis going on in the back end. Specifically, there was follow-up when it came to the prostatectomy episode and some of their urology ones. We are very close to finishing some internal analysis, and we'll communicate that either in the next May meeting, or if we feel like we need to, have specifically for that specialty, we're happy to do that. And then 2 other areas, the cardiology episodes, there's conversation or there's considerations about eligibility for those, since the grouping and specifications there's more of them than there was in Prometheus, so there is some concern about eligibility there. And then finally, there was the development through PACES of 2 lumbar episodes. So they recently got released, and we're going to, again, be doing some analysis and crosswalk on those since they weren't available when we first did the orthopedic crosswalk. As mentioned, a lot of that, as it comes to cardiology, has to do with eligibility. We are committed to ensuring that everyone who is currently eligible under Prometheus would also be eligible under PACES. Again, the specifications of how that work is something that we're working on and will communicate. And then when it comes to resources for you all, we really want to make sure that each entity feels comfortable with the groupers being changed. So we will be producing sort of a transition guide, which will help say, hey, if you are enrolled in episodes A and B under Prometheus, we recommend, these episodes under PACES, things like that. We also are, very happy that we will be able to do the data processing internally. So with that, there will be a new data, monthly data schedule, and we'll work on getting that pushed out. Keep in mind, the first round won't be done until March of 2025, but we would expect monthly updates after that. And then finally, we are very much open to continue to meet with specific practices or specialties if they have questions or concerns when it comes to either pieces or anything related to this transition. So that is sort of the update here. Jean, I saw you put a note in about meetings, and I want to pause here. We're kind of through the updates as it comes to PACES. So if there are any questions, either put them in the chat or come off mute. But I'm not really seeing any.
Any questions about PACES or updates or anything that's going on? I mean, Jessica, maybe it'd be helpful just to talk about where we are on some of we did the 6 crosswalk meetings, and maybe it's a good time to talk about the follow-up work that we're doing to try to make sure that we don't have any mismatches from those.
Yeah, certainly. So I think with those meetings, really the 3 ones highlighted here are the big key takeaways with the follow-up. There was probably the most conversation around the urology and the cardiology specialties. Specifically, the prostatectomy episode in urology stood out. So we're doing a much more deep dive on the differences between them, whether it comes to definition or groupings. And then with cardiology, while the episodes and the crosswalks were similar, it really came down to the number, the volume there, and how that that downstream would impact eligibility. Because as you know, you need 11 in an episode and 50 in totality. So we wanted to kind of look at that, and that really may be more of a policy decision of how we look at volume versus deep diving into the definitions, which is sort of where the urology conversation is going.
And then one other quick PACES question as we do the transition. I think we were also adding UTI, correct? Did that also?
UTI is already an existing episode in
just a little different.
Prometheus, so yeah,
Okay.
that's also one that's
all right. And then I think one of the things, and I put in the chat the information about the primary care EQIP subgroup that we've been having. We met yesterday, and we can watch the video and see the slides. But the focus of that group has been working on the special project to create new primary care. But one of the other things we wanted to do was to make sure we had episodes available for primary care doctors so they could participate in EQIP if they wanted the benefit of being in an advanced payment model. And I think the behavioral health episodes, particularly the one around PQR9, the anxiety, and is reoccurring depression, both of them to some extent, but particularly the anxiety disorder could be something the primary care doctor could consider trying to do. And I think we're also looking at the other existing episodes to see where primary care could fit into that, because that was something we did receive feedback on. And we're hoping to be able to have that as something to consider, letting primary care participate in EQIP. So if they don't, for some reason, hit attribution for MDPCP, or they're in track 2 in MDPCP and aren't eligible as an advanced payment model, they could do EQIP to fulfill that piece of the puzzle.
Certainly. Okay, well, great. As mentioned, we are always open to further conversations or specific scenarios as it relates to your all's practice. So with that, I'm going to hand this over to Kim Dixon, a colleague of mine at CRISP, to talk about the Practice Transformation Grant. She'll give some background, but this is something that was sort of first brought up when we did, or the HSCRC completed their PY1 analysis and looking at sort of the distribution of performance and savings. So I'll hand it over to Kim to give some background, and we're actually really excited to sort of share the development of this program that's been going on for the last couple months.
Thanks, Jessica. Can everyone hear me okay? Okay,
Yep.
great. Perfect. So, good morning, everybody. I'm sure, as you know, HSCRC has identified varying readiness levels among the EQIP entities. And because of that, they have pulled together with CRISP to provide support for the entities through this practice transformation grant. I'm going to give a high level overview of this grant, and then we'll go into what the offerings are at this point. So HSCRC has decided to utilize the year one EQIP savings to reinvest back into practice transformation efforts to the entities to help improve, performance and patient outcomes. This grant will provide resources and possible investments for such things such as care management, data analysis, EHR updates, and other items to help practices achieve better patient outcomes and reduce the total cost of care. This program is targeted to begin in January of 2025. Next slide. Again, the goal of this program is to enhance the EQIP entity readiness and support for EQIP entities to engage in the practice transformation efforts to improve overall performance and patient care, or patient outcomes, I should say. The major activities they include, prior to joining the EQIP Practice Transformation Grant Program, the entities will be evaluated on their levels of EQIP readiness. The evaluation findings will include a determination and value for the grant award. HSCRC will award practice transformation grants in 2 annual installments at the beginning of each calendar year to coincide with the EQIP performance period. Each EQIP entity will also have routine reviews to provide additional coaching and oversight. And then after the grant period is over and as a part of the EQIP incentive payment process, HSCRC will conduct a financial settlement with each EQIP entity. Next slide. Okay, so who is eligible for this grant? EQIP entities who are committed to the upcoming performance year and those who did not receive shared savings in program year 1 or program year 2. The funding will be provided by HSCRC depending on the needs of the practice, and there will be an application process that will be set up in the EQIP entity portal, the EEP, and applications will begin being accepted starting in July and will close out in August of this year. Next slide. So the menu items for the practice transformation grant program. I interviewed several practices to sort of discern the overall consensus on what was needed to help make improvements, and the overwhelming majority of practices were looking for basically the following. First and foremost, assistance with data analysis. So providing training or resources to enhance the proficiency in using the claims data and also your EHR data to discern actionable items for quality improvement and cost reduction. They were also looking for help with EHR optimization. I found that many practices were not easily familiar with how to pull reports from their EHR and to analyze that data. So EHR data analytics and reporting, basically offering training on data analytics tools to enhance data-driven decision-making and overall performance. Standardized templates, work with your EHR vendor to customize templates for effective quality reporting for this program, for also MIPS, etc. Software updates, upgrades, and securities. That is establishing a protocol for regular updates to collaborate with the vendors of your EHR to maintain system security and performance. And then interoperability enhancements, just investigating different interoperability solutions to foster seamless data exchange, enhance collaboration among healthcare providers, such things as electronic lab ordering, etc. Okay. Next slide. HCC improvement is another area where many entities felt they needed assistance. So basically, clinical documentation improvement. So these strategies to enhance the CDI process and documentation accuracy, to improve reimbursement and quality metrics, making sure you get accurate reimbursement, reduce payer denials, improve your key performance indicators, improve your quality metrics, and as well as your clinical documentation. Care management is another area where critical area where practice transformation is needed to improve patient outcomes. So essentially having someone to review and or adapt the plan of care that the physician has set forth, address any physical, educational, or psychosocial needs of the patient and family, and identify patients who maybe need additional support, educate patients with self-management strategies to manage and or maybe even improve chronic conditions, provide resource support, education, care coordination before, during, and after transitions to home or other facilities, help to provide medication management and reconciliation, ensuring the patients clearly understand what medications they are still to take and how, refer patients to community services and resources or any other additional help they may need, as well as following up with any ED or IP episodes after the facts. And then lastly, right now we have practice transformation and improvement, performance improvement, where engaged and committed leadership. So we want to foster visible and sustained leadership in each entity to drive practice culture and change, and remove barriers to transformation. We're looking for efficiency of operations. So implement initiatives to streamline workflows and maximize value across practice operations. Quality improvement strategies. We work with you to implement frameworks for quality improvement by identifying areas for improvement in planning, organizing, and monitoring your quality improvements. And then team-based relationships is establishing support for care delivery teams accountable for the patient's populations, ensuring each staff member knows exactly what they are responsible for, and ensuring that efforts are not duplicated. So those are our menu of items that we have right now for the Practice Transformation Grant. I'm going to stop here and just ask if there are any questions. I saw a few things popping up in the chat. So check the chat.
I think those were related to earlier ones.
So I think while you're if it's okay, while you're looking at the chat or seeing if people are thinking of their questions, I did want to point out that one of the things I think you guys have done a really good job developing this is it does not cross over with the current MHCC program at all. The way the current transformation program with MHCC is what it really is doing is helping people get from zero to getting into the program. This, in order to move forward, you have to be in the program. So that means those people are not even eligible for the MHCC one. So it's kind of a perfect fit, and they're two different things that kind of work really well together. So if you know a practice that hasn't started, is not ready, they should go to the MHCC program. If you know somebody who's in EQIP and struggling, or in EQIP and thinks they can do better even, then this is perfect for them. And I did have one question I want to ask you, Kim. I noticed that it seems to be the application level at the practice level, but it might be useful. Is an EQIP entity able to apply as well? Because remember, the entity isn't always a practice. It could be a group of practices, right? Or do the applications, are they going to have to come in through the practice level?
Yeah, and I think that it actually is at the entity level. So when you
Yes.
are enrolling in PY4, as you know, you enroll as an entity, essentially you will see one more little tab or screen that allows you to indicate that your entity would like to apply.
Okay, and then it looks like we got a question from Ms. Tyler. Are entities that did not exist in P1 and 2 eligible?
So currently our proposal is you have to have participated in either PY1 or PY2 or both, mainly because at that point you have shown that there have been deceiving, so there is a need there. Unfortunately, just the timing of the enrollment period, people who just enrolled in PY3 will not know if they've performed well or not. That's certainly something we can discuss internally, but initially we really wanted to focus on those that already have had DIS savings and give them an opportunity, to hopefully have additional resources and help them move into, a savings area for future years.
Well, I do think that we might want to consider if there's some flexibility, if they know they're going to, at least by the time we apply, they should have their first quarter data, right? So they're going to have some indication of where they are if they're in right now, right? But excluding people who are in now, who need help and waiting a whole other year, it does seem like it's a good point that is being made. Maybe can we see if we can have some flexibility on that?
Yeah, I think, like I said, I think we are happy to discuss it and bring it back to the
Okay.
team and certainly, certainly talk about it.
Any other questions on the transformation grant for Kim? Okay, we got a couple that popped in. How long will EQIP entities be eligible for the program transformation grant? Is it a 1-year grant?
So we actually envision it as a 2-year grant because we actually won't know, like, let's say you guys apply and you get the grant for PY4. We won't know final performance for PY4 until calendar year 2027. So in theory, we would give you, you would get it for 2 years because again, we want to ensure that we don't want to remove funds if we're showing success or things like that. So it would be a 2-year when you get it for 2 years. And then I saw a question about how do we apply for the grant during the enrollment period and when we would know if the grant is approved for the entity. Those are great questions. So when you log into the EQIP portal and go through that workflow for enrollment, there will be essentially one more button, one more section that will be the practice transformation grant. And really the application it's going to be relatively short and abbreviated. Then we will work through sort of an evaluation process, which will likely require a little bit more information. But we're hoping to identify those that will have the grant sort of in that late fall area in order to get everything in place prior to the January 1 start.
I have a suggestion for a simple fix to let the people who are in, you could say, have had no savings or DIS savings, because those people would be in the program, but they had no savings. So that would not be that big a deal. And it doesn't really increase the number that much. So anyway, back to the other point, just a suggestion.
No, that's a good point.
All right. I think that's it. Is anybody, and you are allowed to raise your hand and talk. You don't have to be shy, but any other questions for Kim? Do you have any idea of what questions will be included on the application?
So we are, oh, go ahead, Jessica.
No,
sorry.
go ahead, Kim. You were like, you drafted it.
It is in a draft format at the moment, is going through the approval process. Basically, we're looking just to understand a little bit about your practice, your practice name, if you're associated with a hospital entity, what areas you might be looking for help with improvement in. So we'll have all of the menu options listed. It's going to be a very, very brief application process because the evaluation is where we are going to, dig deep into what's going on in your practice and how this grant can actually help you to really improve.
Yeah.
Did that answer your question?
We also may ask some questions about like what current EHR you're on, just some information that will help guide us as far as what resources you may need. And also as we're evaluating, if we get 50 practices going in, we likely will have to make some decisions, but we're hoping to obviously award this to as many that we can, but we're kind of using it as a way to assess the need in the practice.
And we are planning, Chris, Medkai, and HSCRC are planning to have enhanced outreach around EQIP this summer. So we will also have outreach around this grant. And if the Maryland Healthcare Commission grant is renewed, which we're hoping it will be, but won't know obviously for a little bit, then we'll have outreach around all 3 items when we're pushing out EQIP. And I think we're going to really try to especially with the new PACES episodes and the other stuff going on, we're going to really try to go out and do as many meetings as we can with specialty groups and other groups, and we're willing to help anybody sign up, and we'll make sure we have good, simple one-pagers on the grant so people understand the opportunity.
Good job, Kim.
Okay, well, we're happy to have continued conversations, or like I said, if there's input on the grant, please let us know. Just as an FYI, we have our next EQIP subgroup meeting in May. There are additional primary care worker groups also in May and in June. And one thing I didn't add here, but I do want to plug, is CRISP is hosting our annual summit. It is a virtual summit this upcoming Tuesday. So I will drop the registration link, or you can see also the agenda on this for those who can attend. We'd obviously love everyone, but also it is virtual and it will be recorded, and the sessions will be posted on our website afterwards if you are unable to attend the live sessions. So I am adding that. And I think I saw one other question come through. How will the Dis Savings accountability policy be applied to the PACES episode grouper from PY4 and the formation of the practice transformation grant? So we are, at this time, when we evaluated PACES, given that we saw a pretty high level of alignment in the between the episodes, we plan to apply the Dis Savings policy of 2 consecutive years of Dis Savings independent of this grouper change. So it really won't have much of an impact. And those that are in the practice transformation grant, obviously we believe that data analytics will be a big piece of some of the resources that people request. So obviously it would be tailored slightly more towards understanding and applying the PACES grouper versus the Prometheus. But that's really the main difference between the groupers. Let me know if I didn't answer your question correctly, Vicki. Okay, that's all we had prepared. Please let us know if there's any additional questions. Kim, thank you so much for joining us today. And hopefully we see you guys all at the May meeting. Jean, anything else to add? Are we good?
No, I think we're good. I mean, we had 60 some people on today and so few questions. Everybody's calm. They can tell it's going to be a good weekend, I guess. All right. Well, thank you, everybody. See you next time.
Bye.